Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. I wanted to pop on and update everyone about our preclinical trial testing for invisible illnesses. As you may know, or as you can see on the previous video, we started some preclinical trial testing for patients with Ehlers-Danlos and dysautonomia, multiple sclerosis, chronic fatigue or ME, fibromyalgia, rheumatoid arthritis, chronic Lyme disease, and endometriosis. It is going well, my friends. As you likely know, if you're on the forum at Preclinical.com, the Ehlers-Danlos slots filled up almost immediately. And some of you folks out there, you know who you are, have already had enough testing to slide right onto the list for treatment trials. If you've been working with me with your illness through our wonderful, yet sometimes hellish, a few years, you're on the list. No worries, okay? I'm hoping that we won't need a placebo group for treatment trials once the science is revealed. Fingers crossed. Now, I could still use 1 or 2 chronic fatigue and or chronic Lyme disease patients. I may need 1 more rheumatoid arthritis patient, and if you have chronic endometriosis, I'd like to talk to you too. So if you could jump on the forum at Preclinical.com, I'll pop on a couple times a week and I'll try to circle back with you, okay? Thank you. Also, I posted the financial state of Preclinical.com under articles and handouts. I wanted to take a moment to thank the wonderful folks out there who have donated to the cause. I didn't know if you all needed to have your privacy protected, so I put your first name and last initial. I'm happy to put your full name, so please don't hesitate to let me know if you'd like me to do that, okay? And you can contact me through my contact page at Preclinical.com, and also please let me know if I've left anybody out. Yikes, I sure didn't mean to. But to all those folks who took that big leap of faith in writing that check, I thank you and pledge to you that every penny will go straight to research and studies. I do not have a profit, as you'll see, to take a salary, and I don't expect one, period. Now, before treatment trials, we will make an effort to raise some necessary funds, and I thought it was important for everyone to see the monetary investment I've made in our research so far. Yes, it is a killer, but I believe it will be worth it for everyone. If we can return to the workforce, for example, just think of the return that will give us. I'll post more about treatment trials as we get closer, okay? A tremendous amount of money right now is going to attorneys, a necessary evil, right? Kidding, sort of. Love you guys. Thank you so much for your help and support, by the way. Now, I had a fear that these videos may give you the feeling that my journey has been easy. Far from it, my friends. I have suffered like you have, but since I have the advantage of some medical knowledge and am able to whip through some of these journal articles and create clinical trials, it gives me a huge advantage. I also decided to donate my body to science while still using it, as you know, and I wanted you to know that I mean that quite literally. I always followed science and had to put things through my intuitive filter too, but I've tried numerous medications and even went so far as to have angioplasty for CCSVI. Although I didn't respond to angioplasty beyond the few days of clear thinking the first week, I knew I needed to figure out how our veins are involved. I believe I now know. And considering our systemic vessel weakness for myself and my children, I personally would think twice before damaging our delicate endothelium further, okay? More on that later. Meanwhile, here are a couple of pictures my husband took of my anatomy donations, the self-administered medication trials. Yeeks. Be glad that I am working on these for you, okay? This is not something you want to try at home. And here are some medications I'm working on. My mother-in-law saw this and she said, "Oh, how awful, you have to take all these every day." "Oh no," I replied, 3 times a day. Now let me do this for you, okay? We won't end up needing this much medication in the end, I promise. But meanwhile, we have to work out which ones are more effective and dosages, etc. So now, my friends, let's continue to change our worlds, one brain cell at a time if we have to. I have gotten a fair number of requests at the end of the bloopers for the dancing material, and which, thank you, you all are very kind. But since my son is here, I thought maybe he could provide that for you today. What do you think? Oh, I have never seen a 14-year-old boy run that fast out of the room before. Maybe next time, huh? Doubtful.